broadly, like the spur of research following the 2003 SARS-CoV-1 epidemic. Researchers at the National Institutes of Health, our national publicly funded medical research agency, and across the nation have made major strides in evaluating spike proteins in other kinds of coronaviruses over the years, laying the groundwork for these new COVID-19 vaccines and allowing the current vaccine developers to move as fast as they have. So in the early months of this pandemic, starting last January with the release of the genetic sequence of the virus that causes COVID-19, researchers the world over immediately jumped on how to best approach this virus using vaccine technology. From there, and long before any of these vaccine candidates come close to any humans, they're tested repeatedly in laboratories and on animals. You may remember back in the spring we saw articles about how COVID-19 vaccines were faring on monkeys and mice. In the example of Pfizer, researchers in the United States and Germany evaluated 4 different vaccine candidates to see what demonstrated the most effective and safe early results. Once a vaccine passes early safety protocols, clinical trials begin. And again, these are designed in accordance with what the FDA requires from a vaccine candidate, meaning they are rigorously evaluated and meticulously documented for when the FDA ultimately begins its review. When human trials begin for U.S. drug development, everything is reviewed extensively by institutional review boards. These are independent groups of scientists who help ensure the integrity of the clinical research, both from the standpoint of scientific validity and the protection of participating individuals. These independent scientists review a trial before it begins and periodically as it occurs with a sole focus on protecting the rights and welfare of the human participants. They can require modifications or even disapprove a research project altogether. Phase 1 clinical trials per the FDA might include anywhere from 20 to 100 or so volunteers who have not had prior exposure to the disease. In this pandemic, the Pfizer vaccine alone ran a much larger than usual phase 1 trial of 195 people. One group of trial participants receives a placebo, and another group received one of 2 vaccine candidates. From there, researchers evaluated the effectiveness of the candidates in terms of immune response, as well as reported side effects. And they chose to proceed with the most effective of those 2 options with the least potential side effects. But no matter which candidate people received, no participants recorded any serious adverse side effects. And phase 1 is just the beginning of the human testing that's involved. Phase 2 involves an even larger group of participants to cover a more diverse population and observe if there are any further adverse reactions. In July, Pfizer began recruiting for its final phase 3 testing of more than 40,000 people, including those up to age 85, giving us months of data from the final phase alone. What the FDA is looking at for these trials is additional information on common short-term side effects and risks, the relationship between the dosage size and the immune response, and a comparison to the placebo group. The Pfizer vaccine did extraordinarily well, reaching an efficacy rate of 95% in participants, and even 94% in those over 65. Almost all patients experienced little to no undesirable side effects from the vaccine, with Pfizer reporting that the most severe effects that people experienced were fatigue and headache, both in under 4% of cases. The United States Federal Drug Administration proudly considers itself to have the safest, most thorough review processes in the world, and the world views the FDA in that way, too. On November 20th, Pfizer submitted its data, literally tens of thousands of pages worth, to the FDA, which takes that raw information and combs through it again with the specific purpose of never relying on any conclusion that the company came to. It will redo statistical calculations and entirely reevaluate months of safety data, working days, nights, and weekends, all with the goal of evaluating clinical effectiveness, antibody levels, and safety. FDA analysts will also pore over the entire production, manufacturing, and operations enterprise, examining the facilities and protocols for consistency and for safety. So exactly what will the December 10th meeting entail? Well, it's a review of conclusions reached by an entirely independent body of vaccine experts from outside the FDA who have looked at all of the FDA's findings and Pfizer's findings again. I've said it before and I'll say it again. Illinois will only distribute a vaccine that is deemed safe. And we are one of many states that have established additional review panels, including Indiana, California, New York, West Virginia, and Michigan. Our Illinois team is already poring over the analysis released by the FDA on the Pfizer-BioNTech vaccine this morning. We all want to make sure this vaccine is safe, and additional sets of eyes on the evidence can only be helpful. As much as I can stand up here and talk about the incredible collaboration and effort that went into ensuring as safe a process as possible, it's even better for you to be able to hear it directly from someone who experienced the trials firsthand. So I'm so glad to be joined today by one of the first participants to roll up their sleeves for the Moderna vaccine trial site right here at the University of Illinois, Chicago. Joining us because she wants to share her story and the mission that drove her first to participate in the trial and then to speak out about it. Previously a senior case manager in the HIV program at Providence Hospital of Cook County, Bonnie Blue, now 68 years old, has lived a life dedicated to the health and wellness of others. Her selfless spirit, frankly, is inspiring. So take it away, Bonnie.
Thank you, Governor. Well, this virus has really shaken the world. It's not a flu. It's not something that you can easily recover from. I have spent the majority of my life, actually since I was 19 years old, working to exist. My asthma has caused me to be on life support at least 13 times, most of which I don't recall. But what I do recall is when you are sick like that, it's important to have friends and family and even healthcare professionals that are there to hold your hand, to say something to make you smile, to make you feel like you're going to be all right. Unfortunately, with this virus, patients don't have that option. Their parents are not able to be there for them. The children aren't there to kiss the parent on the forehead when they're on life support. And because of the strain that our medical staff is under, we don't have the nurses or other hospital personnel that can even hold the phone up to that patient's ear so they can hear a loved one. So that's why it's ultra important for us to stay as safe and as healthy as we possibly can. Now, these trials were not something that I was planning to do. I was among the large group of people that were of the mindset of I'll wait a year or two and then I'll try it. But After I saw so many numbers just growing, each number, and this may sound odd, each number I attached that first woman that died in Illinois. That woman's face, and unfortunately, I don't remember her name, but I remember her face. And for each of those numbers that we see daily, growing. We're seeing that woman, that man, that child. Those are families that are not going to be here. And before there were vaccines available, okay, we had options. For my asthma, the options or tools that were given to me to help me live were I couldn't have pets, I couldn't have carpeting or curtains, okay? The science community has given us things to help us live through this virus. Mask, simple, put it on, okay? And if you don't like the plain little white ones, get a nice little cute one with colors, but make sure that it's double layered so that the virus has a more difficult time getting through. Use your hand sanitizer and love people from a distance. You can use your telephone to Duo or FaceTime or Zoom to have that one-on-one connection, but you want to be able to be alive when this vaccine, all of these vaccines roll out, so that maybe by the end of the summer we can get together and have all of the celebrations together at that time, outside, of course. You can celebrate Christmas, Hanukkah, birthdays, anniversaries, all outside and still be alive. Now, for me, and I'm not going to take up all of your time, but for me, my body is fragile. That's what I've been told by the doctors. But I do what I have to do. We all have to do what we have to do until these vaccines are widely available to us all. These are not vaccines that someone just whipped up in a couple of months because, you know, we had a catchy name for it. No, these, as the governor says, this is something that has been studied over years. And fortunately, it's a blessing to be able to have these here now for us so that we can continue to live. So our children and our grandchildren, and yes, for people like me, my great-grandchildren will have a chance to spend time with me, and I can pass on our family cultures and traditions. So what I am asking is, please do what you have to do to stay safe. When the vaccines become available, please take it. Do your research, find out more about it. Don't just take my word for it, but look at me here. For a person that has been on life support so many times, for me to take part in this trial was a huge risk, a risk that my family and friends were not happy that I was taking. But I'm here. I am fine. I did not have horrible side effects from anything. You know, you have the little fatigue, the little headache, as the governor mentioned, but then those resolve. And then you're able to go on and live your life. So I'm really excited about this. And I am prayerful that people will do what most people say. I will do anything for my family. So if you will do anything for your family, survive for your family, guide your family into doing what they need to do to live.
Thank you very much, Bonnie. Thank you for sharing your story. It's very inspiring, honestly. Bonnie was one of the very first people to take the vaccine. She went through the trials. I got to share some time with her and hear her personal story, and I'm very motivated by somebody who's so giving that they're willing to step out there and be part of a trial like this, even though she had her own health challenges unrelated, and wanted people to know today that the vaccine that she took, the Moderna vaccine, was safe for her. She's had it for months now. I mean, literally, she was one of the first trial participants. So anyway, with that, I'd like to turn it over to Dr. Ngozi Ezike for today's medical update.
Thank you. Good afternoon, and a huge thank you to Ms. Blue. Thank you for your willingness to be a part of science and a part of history, and to help us end this pandemic sooner. By helping us eliminate the virus, we will be able to get back to a strong economy, be able to get back to a normal sense of living, be able to have everyone in school all the time. Thank you for your participation in the clinical trial. I think you have accomplished with your visit today more than we could accomplish in hours of standing up here. So thank you so much, Ms. Blue. Today, we are reporting 7,910 new individuals that were diagnosed with COVID-19 for a total of 804,174 total individuals in Illinois with COVID-19. Over the last 24 hours, IDPH has received notice of an additional 145 individuals that lost their battle with COVID for a total of 13,487 Illinoisans no longer with us. Overnight, 5,199 individuals were in hospitals across the state with COVID, and of those, 1,071 were in the intensive care units of the hospital, and 626 were on ventilators. In the last 24 hours, almost 96,000 tests have been reported for a total of more than 11.2 million tests this year. As the governor said, safety is our top priority as we prepare for the rollout of this COVID-19 vaccine. And while the vaccine is coming, it is not going to be as much as we want, and it's not going to come out as quickly as we'd like. I would love to be able to snap our fingers and have everyone have it, but that's not how it's going to be. The first groups to receive the vaccine will be our healthcare workers, and again, I've described that. It's a broad category, and it's also the residents of long-term care facilities. However, due again to the limited supply of this vaccine available in the U.S., it will take months to roll out the vaccine to the priority groups, and even longer for it to be given to the general public. I ask that people be patient. Patience. We can only allocate the vaccine that we're actually given, so we're prioritizing those at greatest risk of exposure and severe illness. And then we will continue to move through those established priorities. I hope people will understand that, yes, there will be people that will get the vaccine before you, but we are hoping for everyone to get this vaccine in the coming year. And while I love the clamor and all the questions about who will be first and who comes before who, I know that there's still another bunch that is completely anxious and is wanting to take a serious pause. There are others who are just hesitant, including some healthcare workers. I encourage people to look to the FDA and the Advisory Committee on Immunization Practices so that they can get all the information. IDPH will continue to put out information about this vaccine as well, and we'll be working with various community groups to make sure that everyone has the information they need to make an informed decision. Our path towards ending this pandemic is layered. There's never been a single one-off solution. Even vaccine alone is not going to do it. We still are going to need to wear our masks. We still are going to need to limit our gatherings and watch our distance. But absolutely, this vaccine is a key weapon in our arsenal. And I can't wait to make this available to as many people as possible. Without using these tried and true public health measures, without vaccination, this pandemic will extend longer than it needs to. That means taking more lives than it already has. It means destroying more businesses than it already has. and stealing more peace of mind than it already has. Let's fight back and let's do what it takes to get us to the end sooner. Thank you. Gracias, señora Bonnie Blue, por su decisión a promover la ciencia y a ayudarnos a terminar esta pandemia por participar en ensayos clínicos para una vacuna COVID-19. Hoy informamos 7,910 nuevas personas con COVID-19 para un total de más de 804,000 personas en Illinois desde el principio. También ha recibido noticias de 145 muertes para un total de más de 13,400 personas que han perdido la vida por COVID-19. Desde anoche, 5,199 personas estaban en el hospital con COVID-19. De ellos, 1,071 pacientes estaban en la unidad de cuidados intensivos y 626 pacientes estaban en ventiladores. En las últimas 24 horas se han reportado más de 95,000 pruebas para un total de más de 11.2 millones de pruebas aquí en Illinois. Como dijo el gobernador, la seguridad es nuestra máxima prioridad mientras nos preparamos para el lanzamiento de una vacuna por COVID-19. Y mientras llega la vacuna, no llega en la cantidad ni tan pronto como nos gustaría. Los primeros grupos en recibir la vacuna serán los trabajadores de salud y los residentes de los centros de atención a largo plazo. Sin embargo, debido al número limitado de vacunas disponibles en los Estados Unidos, llevará tiempo implementar la vacuna en los grupos prioritarios, incluso cuando es tiempo para el público en general. Estamos hablando de muchos meses. Le pido a la gente que tenga paciencia. Por favor, paciencia. Solo podemos administrar la vacuna que recibamos. Por eso, priorizamos a gente que tiene mayor riesgo de exposición o enfermedad grave. Espero que la gente comprenda que puede haber otros que van a recibir la vacuna antes que ellos. Si bien hay quienes están ansiosos para recibir vacunas prontos, hay otros que dudan y no quieren recibir la vacuna, incluidos algunos trabajadores de la salud. Animo a la gente que consultan a la FDA y al Comité Asesor sobre Prácticas de Inmunización si tiene dudas sobre una vacuna. Nuestro camino para poner fin a esta pandemia tiene varios niveles. Debemos seguir usando nuestras máscaras, evitar reuniones y mantener nuestra distancia. Lavarnos las manos, pero también vacunarnos cuando la vacuna esté disponible para nosotros. Si las personas no se vacunen y no sigan las prácticas de salud pública probadas y verdaderas, esta pandemia solo continuará. Pero eso tenemos que seguir trabajando juntos para salir adelante. Muchísimas gracias para su apoyo. And with that, I will turn it back over to Governor Pritzker.
Thank you very much, Dr. Mary Ann.
Thank you. Do you have a timetable yet, if all goes well on Thursday with Pfizer? When might those first vaccine shots be given out here in Illinois?
Well, all I can tell you is what we're being told about the delivery timing, and I want to make clear that the CDC and the federal government has been giving us slightly different information or more information each day. So I don't want to lay out a perfect timeline for you and have you think that now you can just watch each thing occur. But I will say that they originally have told us that the week of December 13th to the 19th is the time in which we would start to see the delivery of the vaccines. There is also a rumor out there, but again, a little bit unproven, that if they approve it on Thursday, that they've pre-positioned it possibly to get here by the weekend, which would be a little bit before the 13th, which would be the beginning of that period I just talked about. So, so that's what I know about the first arrivals. Doctor, you've been on the phone today with the CDC, so do you have anything to add to that?
Yeah, we know that we'll be.
Please.
Sorry, sir. I mean, we are expecting vaccine. Oops, I'm locked in here. Okay. We are expecting vaccine next week, and then we expect vaccine every week after. And again, depending on which vaccines are approved, we may be looking at Pfizer initially, but hopefully other vaccines will be coming on. We know that the FDA is already evaluating for the Moderna vaccine. So it's hard, you know, we have numbers, but we're waiting to see approvals and waiting to see like finalized numbers, which, you know, may not be finalized till closer to the time, but we are very much looking forward to weekly allocations of vaccine to come to the people of Illinois.
When it does get to the point that beyond the hospitals, do you envision the people throughout the state going to schools or parks, or where do you envision them going to get the vaccine?
Oh, it's going to be an all-in Illinois effort. People will go to their doctor's offices. There will be mass vaccination drives. Some will be held in churches. Some people will go to pharmacies. They will go to the federally qualified health centers. They will go to their local health departments. There will be many different groups. There will be some EMS groups that will be participating in this effort. So there's a myriad of opportunities to get the vaccine. We're even working at the state level to have some drive-through vaccination efforts. So there will be lots of opportunities. Those will continue to ramp up, especially as it becomes widely available to all the public. We will need all hands on board to be able to get as many people vaccinated as quickly as possible so we can get back to our normal lives, get back to our great economy, get back to living life the way we were used to in 2019.
And Mary Ann, if I could just add to that, that each county has put a plan together. So they know best in Pulaski County where the locations should be that work best for them. It might be at the county health department is a great location, and some other county that might not be the best location. So those each county has submitted to IDPH. But I would add that the city of Chicago has a separate plan for the entire city. And so it would behoove you, at least for the city of Chicago, to talk to them, because there's so many neighborhoods and places in the city of Chicago where someone could go, and I know that those decisions haven't yet been finalized by the city's Department of Public Health.
One point of clarification, the vaccine's going to go to Walgreens and CVS. For these strike teams, we understand that are going to go to the long-term care facilities.
Right.
Is that being coordinated by the state? Is that part of the 109,000, or is that a separate number that's to supplement?
It is being coordinated with the state, but it is being delivered by CVS and Walgreens. They're the ones who are, essentially going to provide the people and the vaccines in the long-term care facilities directly. But we are in communication with directly with CVS and Walgreens to make sure that, we're coordinating. Is there anything you want to add to, I know
and those doses come out of our initial dose.
They do. They come out of the numbers that you'll hear from me, because those are coming to the state. Who delivers them is, another question. But in terms of the total numbers of vaccines that come to the state, I'll be talking about those numbers as they are delivered to us. But it is CVS and Walgreens who will actually go to the long-term care facilities.
Governor, you have indicated that you're not going to be mandating vaccines for individuals, but what about those who work at state hospitals, in prisons, in congregate livings run by the state? Can you give us a progress report on your department's conversations about what's expected of staffers inside those kind of facilities?
Sure.
Is there a chance that mandated vaccine will be a reality?
I'll ask Dr. Zike to. We're still lots still in flux, but no mandates in place right now.
So we obviously understand the importance of this resource and what it can mean, especially to these congregate care facilities, in terms of having fully vaccinated staff. And so as we have right now in the hospitals, you know, there's all healthcare workers are encouraged to get the flu shot. There are people who don't get it, and there are other protocols that are in place to deal with people who will not or cannot take the flu shot. I can imagine maybe it'll be something similar to that. Everybody will be strongly encouraged for obvious reasons as to why they should want to participate in this important effort. And then for people who are not vaccinated, there will be other policies and procedures that will continue to ensure the safety of the people that they are there to care for.
So meaning if you're an employee at a state hospital and you refuse to take the vaccine, you might be moved to a separate space. These sort of contingencies.
There are different protocols. Maybe, you know, if there's a situation where again, I can't wait for that time, where everybody vaccine is available to everyone and there's no barrier to anyone getting vaccinated, and there's a few people who have not been, you know, maybe there's reassignment, maybe they have to continue wearing masks, you know, all those kinds of things, but those have not been mapped out, and there is no mandate in place.
Can you clarify though, Chris, can you clarify what you mean by a state hospital?
There's no such thing as a
I
state.
mean, when you're talking about the Illinois Department of Human Services, if you're
State
talking
facilities.
About state facilities.
Okay.
sorry,
Yeah,
not
same,
hospitals, But
yeah.
in those kind of locations, that's what you're talking about,
Yeah.
right? Is shifting resources as needed.
Having protocols in place to adjust that.
Dr. Ziggy, just to follow up, there was a story I heard today that said that a lot of people are skeptical about the vaccine, hearing it from politicians. They trust the doctors more. Is there any concern that you have that maybe the messaging needs to come more from healthcare? And then what do you say to the skeptics, particularly in the Black and brown communities where there is a greater deal of skepticism?
Yeah, no, there's a lot of work to be done there, and there's very valid reasons why that skepticism exists. Public health is not always done right by communities of color. Everyone points to the Tuskegee syphilis experiment, but that's just one example. There are many examples where government has done wrong by Black people specifically, and so there's a lot of work that's going to be done. I'll be working with the Chicago Urban League. I'll be working with the National Urban League. I'll be working with churches across the state. We'll be working with many different groups that have inroads into these communities so that we can give the appropriate information, that we can answer questions, that we can make sure that we can dispel the things that are clear myths and work on the real issues that are still barriers. People, I've heard all kinds of, oh, they have put X, Y, and Z in this vaccine, and that's why I won't take it. We just need to get to the real facts and then let people make their best decision for themselves and their family and understand the risk-benefit ratio of the decisions that they might be contemplating.
So your underlying message to people as a medical professional is what about these vaccines?
Yes, I am happy to share all the information that's been laid out in terms of the effectiveness. We know that now. Again, I'm working with our Illinois advisory team, our vaccine advisory team. They are poring over the information that was released just this morning. I think there'll be more at the end of this week as well. And we know that there are things we know and the things that we don't know, but we can use the history of science of vaccine, the vaccine science, which is, decades and decades of information, to be able to extrapolate some of the questions that people may have for things where the data is not there yet because this vaccine hasn't been here for years. We know that this platform that people are concerned about because it's new, we know that it's been used in other instances. It's been used to deliver, cancer therapies. It's been used for, I think, chikungunya and CM cytomegalovirus. So there is experience with this platform, and so we're going to use all of that science plus what we have from the actual trials here to give all the information that people need, hopefully to allay their fears, at least educate them fully so that they can make their own individual choices.
We'll
May
do
I
one more in the
follow
room.
up to yesterday's, I think you were asked about this, but the choosing of the counties. Stark County, for example, 5,000 people, only 4 deaths. Why is that higher up on the list? And the county doesn't have a hospital, so where do those vaccines go to get to the residents of that county?
Right. So again, remember, as I tried to explain yesterday, that because the guidance and the from the ACIP was changing as we were developing our plans, the initial guidance was that it would be for healthcare workers and then also first responders, which whether you have a hospital or not, you're going to have first responders. And initially, healthcare workers, we could figure out there are healthcare workers in that town. Now, as the prioritization has come to have the long-term care residents with the healthcare workers, and because we have created this framework, we have been working, in fact, my team has been on the phone with the leaders in those counties to talk about the fact that since we were focusing on hospitals just for week one, what is the best strategy moving forward? Should we identify the hospitals that your residents actually go to and say that we can allocate to those facilities since there isn't an actual hospital? And so those conversations are going on. Again, this is a process that's going to be in flux and amended and updated and upgraded for the entire, for all of next year. So we understand that people have questions and we'll continue to answer them, but please understand that we're continuing to evolve as we move through this
All right,
process.
this will be the last one.
What's the timeline for the state review panel? So, say for instance, Pfizer's approved Thursday. When do you sign off on the vaccine?
Right. So I met with my team, the vaccine advisory group, last week. I talked with some, actually virtually online today, and they are an amazing bunch, as busy as they are, clinicians and researchers and scientists. They all understood that everything that comes out on Thursday, they will pour into immediately understanding the urgency, and even the information that came out today. As soon as I put that out, people were like, I'm on this right now. So everybody understands the urgency, and everyone is going to put this as their top priority.
All right, Craig, you had one from your colleague, and you're the last one.
Yeah, Governor,
Yep.
my colleague Alexis McFadden says we're going to start off. The Aurelio's Pizza in Joliet that is reopened, they're doing 25% in person, in dining capacity.
Yep.
Can we get your reaction to that? And is the local health department supposed to be the one enforcing this?
Well, I think because I've said it, I don't know how many times from this podium, that local authorities, including the local health department, local law enforcement, local elected officials, the local state's attorney, all are responsible for enforcing the laws of the state, including executive orders and regulations. And so it's, allowing a restaurant to open in defiance of the law is literally ignoring the fact that people will get sick as a result of the actions of these elected officials, law enforcement, and others who are not stopping it. Typically, local departments of public health want it stopped, but they don't have the personnel, the law enforcement, the elected officials behind them. And so it is very difficult in some places. And I understand the plight. Listen, I read the story about the owners and the difficulty of their business, staying closed to indoor service. So many people are going through that difficulty right now, and we're trying to get resources to those folks. But people who act in defiance of the rules and allow people to get sick, which is what will happen when you have indoor service, and you're allowing people to gather and amplify the virus in a moment, by the way, when we are in literally the worst time of the pandemic, I think is something that these people are going to have to live with for the rest of their lives. They will have had a very negative effect on the people who live in their communities, and I would encourage people who live in those communities not only to not patronize those establishments now, but to remind them after the pandemic that they were not protecting the population.
All right, we got to get online. Jim Haggerty at the Rockford Advocate. Is there anything long-term care centers can do differently at this point to mitigate the spread of COVID-19, or is it up to us, the general public, to better protect the at-risk residents at nursing homes?
Well, we have applied everything that we have learned along the way to long-term care facilities. We've learned from other states. We've learned along the way from doctors and researchers here in the state. We've followed not only all the CDC guidelines, but tried to be even tougher in those facilities in order to keep people safe. As you can tell, all over the country, no matter what you do, to a large degree, there just are so many ways that the virus can get in. So what you want is lots of protocols in place to make sure that you can catch it early, make sure people get treated properly, and so on. Are there more things that could be done? Maybe. I'm open always to suggestions. I've listened to doctors and epidemiologists and scientists all along, and I'll continue to do that. I would like very much to keep everybody safe to the end of this pandemic, and I'll continue to do my best and try to address it in every way that I can.
Charlie Meyerson at ChicagoPublicSquare.com. As vaccines roll out, will the state issue guidance for those enforcing masking rules, like store and restaurant managers, on how to tell who's been vaccinated and who hasn't, and who has to wear a mask and who doesn't?
So is the question, how will people be able to tell if you've had the vaccine? Is that the question?
Yeah.
Yeah, it's a great question, because we've actually had conversations with the federal government about, are they going to provide a standardized method, whether it's an app or a piece of paper. You remember, for any of you who've traveled internationally, sometimes historically they've given you a yellow card to go in your passport that would show your vaccines. We've put that question to the federal government. We have some options in the state as well. What we would like to do is to give everybody some ability to prove that they've had the vaccine, and a reminder, indeed, that they need to go back for their second dose if they've had the first dose. So we're looking at all the options here.
Elizabeth Matthews at Fox, what are your thoughts on the illegal parties that continue to take place in Chicago while the rest of us are masking up and keeping our distance?
Well, I am glad that the mayor of the city of Chicago and the city council have been, and the law enforcement has been enforcing the rules in the city. People who are holding private parties and who don't get fined, I think, once again, I mean, this is on them. I think people in their neighborhoods know who they are. It's a terrible way to treat your community, to have a party like this, to help spread the virus in that way, especially when we're this close to having vaccines available to everybody. Just hang on a little longer. You can do without a party for a couple months while we get to saving people's lives.
Mike Militich at Quincy TV. The average number of deaths continues to rise. I know this is something no one wants to think about, but do you have any projections on how high the daily death toll could get before the end of the new year?
I don't have a projection for you, but I will say that if you look at the numbers, they're actually, I don't want to say we've peaked, because you just don't know, but I will say the numbers over the last couple of days, and if you look at the averages over the last few days, they're actually coming down. So you can't rely entirely on a few days' data. It's why we often do averages. It's every number that I look at, every time I look at that number, it's devastating to me. When I want these numbers to come down. Of course, I cheer when the numbers are coming down, of course, but when you have an average of 150 people dying a day, and you look at the dashboard, as I do every day, and see 90 people died, I mean, what am I supposed to think? Am I supposed to feel good about that? And I don't. And all I can say is that the virus is deadly. Maybe I ought to, aim my answer at the question you asked before about people having parties, people opening up their restaurants when they shouldn't. That there are 90 families that die, 148 today, families that lost somebody.
Ryan Boyles at Health News Illinois. There's been talk in other states about possibly allowing healthcare professionals like dentists and optometrists to administer the COVID-19 vaccines when they become more readily available. Are these conversations happening in Illinois, and is this something the administration would consider authorizing in the future?
Go ahead.
No, again, but we don't want to have ample stores of vaccine, and then the problem is that we don't have someone to help put it in the arms. So absolutely all conversations are on the table. I think dentists, maybe do have the ability to participate in this process, and we can look at expanding whether, students, whether it's nursing students, medical students, et cetera. So no, we want to be clear that we are going to get all the resources we need, all the help that we need so that we can expedite this process and safely of getting people who are appropriately trained to put this vaccine in people's arms so that we can get to the end of this pandemic journey.
Dr. Zika, you could just hang out there.
Yep.
You probably answer this one. Jake Griffin at the Daily Herald. Does the state plan to ultimately make vaccination of school children a requirement for attendance at public schools? Why or why not?
Yeah. So again, that's we're still struggling with getting uptake of vaccines for the ones that are required by IDPH now. And so I'm not sure, again, that has to be legislated. And I think some of the recent conversations a year ago when we were talking about trying to deal with people just using, loopholes to get around getting immunizations, which caused that mini outbreak of measles that we started to see. That was a challenge then. So I guess before we're talking about any additional mandates, I think we just want to get past the situation that we are in now, and then when this is in the rearview mirror, we can talk about what we will need to do to keep it in the rearview mirror, and if school mandates would have to be part of that. But no decisions have been made about
And then
that.
can you just talk a little bit about the fact that it hasn't been tested on children yet?
Right. So all the studies so far have been on ages 18 and over. And so I do not think this Thursday that we will get information that will allow us, by ACIP or by the FDA, we will probably not get any recommendations that this can be used on the pediatric population. It would have to be where there will be additional trials done that involve younger people. Maybe they could say that, a 16-year-old is close enough to an 18-year-old, but we definitely know that a 5-year-old, their physiology is not the same as a 16-year-old. So again, we need to kind of deal with where we are now, and then at a time much later, we can talk about what's available for kids and what needs to be mandated around that.
And then Dan Petrella has one you could probably answer as well. Has the number of doses for the Pfizer vaccine in Illinois changed since Friday? And is there any update on how many doses of Moderna's vaccine we can expect to receive?
Yeah, so we're still working with the 109,000 for the first week after approval. 109 is inclusive of the Chicago allocation and the entire state. And we have gotten numbers for Moderna, assuming, again, based on the supposition of getting the EUA, the emergency use authorization, we do potentially have vaccine that would be coming the week after that approval, and for at least a week and 2 weeks, maybe before the end of this year.
Is there a number for Moderna at this time?
Yes, there was. I think in the first week after it comes out, it was something in the tune of 400,000. So that's what I'm recalling off the top of my head, and I don't know if they're going to make any changes to that number.
How much for Chicago?
400,000?
That's inclusive of both.
You don't know what the divide?
21%.
It's usually they take their.
Oh, 21%.
Yeah, it's a population divide. And I will say, based upon all of the moving numbers around the Pfizer vaccine, I wouldn't write a story that pins down 400,000 Moderna vaccines arriving. It's very difficult to know right at the moment, as we've seen with Pfizer. Right, we heard a number, we had to cut it in half. Then we heard it. Then they came back and said, no, you can deliver those 109,000 because we're going to deliver you more later. And honestly, the numbers for the subsequent weeks have adjusted over time. I am, I'll believe it when I see it, when they arrive.
Hannah Mizell at NPR Illinois. Governor, was the LaSalle Veterans Home Administrator fired based on information found when the U.S. VA did a site visit a few weeks ago, or IDPH's site visit, or is it based on newly discovered information? If it's not new information, why did you wait until yesterday to terminate her?
No, there's an ongoing effort to try to determine all of the things that may have led to the disease spreading in the home. And so, you're over time, literally every day, there's a different evaluation that's going on of different protocols for all of our veterans' homes to make sure that they're safe. And we're trying to upgrade, improve, et cetera, ask people questions. But you also know that there's an independent look that's being done by an OIG from the Department of Human Services. And so we'll know more over time. But we wanted to make changes as quickly as possible to put the best people in the right places because all we want is to keep these heroes safe. And to be honest with you, Anthony Vaughn is a terrific administrator. He'll do a great job leading that home.
This is a follow-up from Hannah. There's also a rumor that you're planning on sending in the National Guard to assist with the home. If that's true, why send them now when the outbreak is basically over?
I don't know where you get your rumors from.
Last question will be from Dean Olson at the SGR. How would you describe the size of the anti-vax movement in Illinois, and how are you addressing questions raised by this movement, and how will you address longstanding mistrust in the Black community about the medical industry? We got the second one.
That's yeah. So let's start with, there is an anti-vax community that has pre-existed coronavirus, and that's a little bit what Dr. Ezike was referencing when she said, there were people who were trying to get around the rules with regard to some of the vaccinations that we require, like measles. And so those people pre-exist. They put out lots of misinformation. Some of them are in the same community of people who put out misinformation, like Amy Jacobson and others who purvey the kind of false hoods around coronavirus. So I guess they pre-existed. Maybe they've amplified in some way because of President Trump and all the politics around this. And so I expect that they'll continue to be around. How will we address it? We're trying very hard to first of all, to just put the facts out there. I would hope that people will simply read about the science, read what you all will write. They'll hear what we're saying, what doctors and researchers will say, and be able to overcome the rumors that they hear on Twitter, Facebook, or other social media. Bonnie Blue, who presented here today, is an example of somebody that people should listen to. She has no axe to grind here. She's somebody who volunteered for a trial because she wanted to do the right thing. She's simply telling people, as a 68-year-old Black woman, that she has underlying health conditions. She took the vaccine, and she is doing very well. And she wanted everybody to know.
She doesn't know if she had the vaccine or the placebo.
Okay. Well, what we're trying to say is that it is worthwhile for people to be listening to the science, and she's somebody who has participated in this trial. You're right, she didn't know, but she is somebody who stepped forward to validate that this is a real trial that was going on, that she did have some side effects, so she talked about that. So I would assume that that is an indication that she may have actually received the vaccine. But I don't know, Dr. Ezike, do you want to add to that? Yeah. Go ahead.
I don't know the details for the Moderna vaccine, but I know since they have already collected their data from their trial and submitted it to the FDA, I think that trial has ended. So I think once a study is ended, then you can open up the results of the trial and tell people if they had the vaccine. So I don't know if she was aware or not.
But my point was simply to say that, yes, we're embarked on a campaign to let people know all the facts, to put people up here who, we think are worthwhile to listen to. And I've talked with various leaders around the state. Craig, you raised the question of, are politicians the best people to give the information to people? No, not always. I think there are some people that believe leaders, elected leaders, but there also are, as you've seen throughout this pandemic, I've put researchers, doctors, epidemiologists, people who really know public health and really understand the science so that people can learn more and get all the facts. I'm going to continue to do that. I'll put people up here to make sure that people know whether this vaccine is safe and that there are various communities that are taking it. I want everybody to know all the facts, and then, they'll make up their own minds about it.
Thanks, everyone.
Thank you.